Welcome to Clinical Conversations at High Noon with the Green Nurses at Holistic Caring Network, where we bring hope and inspiration for growth and healing. We are here to change the dialogue and stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. We got a great show for you today, but before we get started, here's a little bit what we do in the cannabis space as nurses.
Change the paradigm of healthcare.
The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I'm the founder of Holistic Caring. We're based here in California, and we do educational programs and case management for patients on how to use cannabis therapeutically as a medicine.
We're also here to decrease stigma around what it means to feel good and be high, hence the H for hope, I for inspiration, G for growth, and H for healing.
As the founder of Holistic Caring, I basically oversee the whole ship, and what we're doing is progressive education.
Cannabis actually supports all 11 organ systems, our immune system, and all the neurotransmitter signaling systems that give messages to tell our body to either do something or not do something. Because the plant was prohibited, it prevented health professionals, doctors and nurses from learning about cannabis as medicine.
I want to change the paradigm of healthcare and us paving the way into a new vanguard of medicine.
It's about education, it's about empowerment, it's about teaching people how to feel good, bridging the gap from what they're not getting from traditional medicine, utilizing different plant medicines, adaptogens, tips, tricks, hugs, and nugs of information to support and nourish the most important system in our body.
It's a lot of soul work, a lot of love, a lot of discipline, and meditation. I'm using my life work as a testimony to others to learn how they can be their own hero and then go help heal the world.
And we are, as nurses, the game changers.
All right, here we are. Welcome, everyone. My name is Sherry Mack, and I'm the Vice President of Nursing at Holistic Caring and the Green Nurse, and I'm a cannabis nurse, patient advocate, activist, and a passionate podcaster here to change the paradigm of healthcare with an amazing team. I'd like to introduce my business partner and co-host for our monthly clinical conversations, Elizabeth Mack. She is the CEO and founder of Holistic Caring Network. And today we have a very special guest, Dr. Philip Blair, presenting a webcast on the benefits of β-Caryophyllene for symptoms, diseases, and how it modulates the endocannabinoid system to keep our bodies in balance. And so we'll answer questions at the end of the presentation, so please type them in the chat box below. And I'd like to introduce Dr. Philip Blair, and then we'll dig right into the presentation.
Let's just get into it.
Okay, excellent. So do you want to introduce Dr. Blair?
Sure. Great. So Dr. Philip Blair is a retired USA Army colonel and is a family physician and consultant in disease management in the Northwest, residing up near Seattle. He graduated from West Point in 1972 and the University of Miami School of Medicine in 1978, trained in family medicine, and served as a combat physician in the 1991 Gulf War. After medical assignments in 3 continents and 29 years in uniform, he retired from the Army and has been consulting on complex care for disease management in health plans and employer groups. Since 2014, Dr. Blair has been studying, treating, writing, and lecturing about cannabidiol and the human body's natural endocannabinoid system. ECS dysfunction appears closely associated with the full range of chronic illness, and his goal is to restore health and performance by enhancing the endocannabinoid system through diet, exercise, appropriate medications, and non-psychoactive healing herbs. In 2021, he co-authored the Medicinal Cannabis and CBD in Mental Health Care and developed BCPLus, an oral non-cannabis CB2 activator, receptor activator, which we'll talk about today, from β-Caryophyllene. So without further ado, let's have Dr. Phil kick off this beautiful presentation.
Excellent. All right, here we go. Let's add to the stream. Welcome, Dr. Blair.
It's so great to be with you and to present this extraordinary topic on this marvelous compound that can do so much to help people both in the cannabis space and in the non-cannabis space. It activates so many things. I'm really excited to discuss this. So my background is, you mentioned, I'm a colonel from the U.S. Army. I retired in 1996, and so now I've been spending much of my career working on other health issues. I'm trained as a family physician, but I've extended that into cannabinoid therapies of all kinds. I believe in the 12th body system, the endocannabinoid system, as being the key factor for changing the body's health and disease. Next slide. So I am an author of a book, a co-author with Kylie O'Brien. We discussed CBD, but we also discussed Caryophyllene as well and the benefits of that. Next. What is Caryophyllene? Well, it's an essential oil. It's common in so many spices, and it alleviates pain, inflammation, anxiety, and metabolic disorders. It has a fantastic range of therapy, but it doesn't have any significant side effects. It's found in thousands of plants, literally thousands of plants. It's got high concentrations in 36, including hemp, and it has a structure that is unique as a bicyclic sesquiterpene. And because of this structure, it is absolutely defensive. It's a defensive chemical for plants. They use it to defend against infestation by insects and to tell other plants what's going on in their lives. Next. So I really like to put it out right away that this is an FDA-approved substance. It's not cannabis. It's FDA-approved as a food flavoring. So, and it's gone through all the testing to evaluate it for the safety of it. Next. How does BCP work? Well, this is a list of the targets for BCP, and you can see innumerable ones that may be familiar, may not be familiar, but they encompass the enzymes in genetic coordination and links, signaling molecules, and all sorts of connections, including the endocannabinoid system and targeting the CB2 receptor. Next. Now, one of the features is as a CB2 receptor agonist, this is the receptor that is on every one of our immune cells, and it orchestrates a shift in the immune system from the attack mode, the pro-inflammatory side, to the anti-inflammatory or the healing side. So we have to have inflammation in our bodies to generate muscle growth, to generate different functions, to generate protection of our bodies. But we don't want to stay in that too long. We need to shift over to the healing phase in order to resolve that and resolve the pain that goes along with it. So this goes from M1 to M2 phase. Next. Now, it's effective on all immune cells and in all immune situations, but it's also ignored generally in the literature as a central nervous system activating substance. And because it's not noted here because it is in such small populations of the neural connections, because it is only really activated in inflammatory situations and is under stress. So the CB2 receptor is dormant and not very active and is a very low population in the brain. But when it gets activated by inflammation or trauma, it increases. And when it increases, we know that it has connections on ion currents, transmitter releases. It's working on the synapses. It's working on the axons. It's working at the membrane potentials, dendritic spikes, and it's working, controlling the excitability of the neurons. So I want to emphasize that this is a key and important, and this is often overlooked. Next. So one of the things that we want to talk about too is, and you'll see this repeatedly in my notes, is the PPAR receptors. And these are peroxisome proliferator activated receptor. And these are nuclear receptors. And so by signaling these particular nuclear receptors, you change the expression of the DNA into the RNA, and the manifesting a cascade of different responses. So that these particular, and then it has to be, it's genetic and it has to be in RNA form, but it concerns quite a bit of our physiology. And I think this is one of the key factors for many of the benefits that come along with it. Now, first up is a PPAR alpha, and PPAR alpha, you see the blends of what this can do. It's working on neuroinflammation. It's working on oxidative stress. It's actually affecting glucose metabolism in tau. So for Alzheimer's disease, it's blocking the tau formation and the inflammatory signals, but it's also working at lipid metabolism. Next slide. And the PPAR gamma also has a cascade of different benefits. In particular, I like to point out that it is particularly effective for converting white fat to brown fat. And it also has a great deal to do with inflammation and controlling inflammation in the body. Next. Now, I really like to hone in on the safety aspects, because BCP is incredibly safe. So the lethal dose of 50% was required more than 5,000 milligrams per kilogram in rats, which is a huge, huge amount. It absolutely, is extraordinary that it would require that much. But they even used intratracheal introduction, and they used it has skin sensitizing effects up to 4%, which is a very high level. And no toxicity, abnormal behavior, histologic changes, or any tumor formation, right? And no reproductive effects on conception, gestation, or ovulation. It activates and it interferes with the CYP, the cytochrome 450 system, the 3 alpha 4 non-competitive binding, and that does interfere with drug metabolism, but I have yet to see any interference with any drugs. Next. So let's talk about CBD and BCP and how they compare. First off, there are certain benefits to using CBD. CBD has effects on epilepsy, Alzheimer's disease, brain injury, wound healing, cancer, but there's some negatives associated with it. There's a little bit of anxiety that can come to it. Some people get a high from using CBD. There are interactions that have been documented. There's a drowsiness that can occur. There's dryness and eye pressure, and there's drug testing positive, which is probably the worst one that has to do with our workers in our military. Whereas Caryophyllene has a really concentrated factor for neuropathology. So pain from neuropathic. Vision, it definitely improves the vision. It has antidepressant issues. It has gut issues, allergic, mast cells, weight loss, diabetes and cholesterol, and addiction. But it doesn't have any significant negative factors as well. Now, I separate them too, but they really work well together. I'll show you slides later on where there's a synergy that occurs that makes them very, very effective together if they need to be put together. Next. So this was a study that was done comparing CBD to BCP and combining the two on a pain model. And in this case, there was significant amount of pain reduction for CBD, for BCP, and when they were combined, there was actually a lesser amount of substance that was required in order to get the same level of relief. So you see they work together, but they work separately too. Next. So I offer this up as some testimonies that I've gotten from it. And the testimonies have come in terms of THC and CBD. And some people, what I find is that some people have their THC requirements go down significantly when they are using BCP along with CBD. They just have they've got a better reduction. They've got a better reduction in pain and autoimmune issues, but they have improvement they don't need as much of THC, and they feel tranquil. And in comparison, CBD, it can be extremely, it can be even more effective than CBD and THC for that matter. So there's quite a bit of variation in it. Next. So I've talked about a number of issues here, and this slide gives you some of the terrain and the landscape that we're dealing with. BCP is effective in all of these conditions, but I can't cover all these conditions in this lecture. I'm going to try, but I can't cover them all. So I'm going to talk a little bit about the studies that have been done, and I'll focus in on particular selection of applications for beta-Caryophyllene and what the literature has shown to be effective, and from my clinical experience. Now, first off, there are only about 10 clinical studies, that 10 human studies have been done on beta-Caryophyllene. So it's really not out there. There's very limited information on a clinical basis, but there's over 3,000 scientific articles in animal models and cell cultures. But these 10 studies do have some influence, but they don't really get the full appreciation for the benefits. So what I want to talk about is this list of parameters and focus conditions for beta-Caryophyllene. And so I'll dive right into those. So with regard to inflammation. Now, I already mentioned that beta-Caryophyllene is highly effective at the CB2 receptor. Now, the CB2 receptors are located on every one of our immune cells, and they control inflammation. And so with the signaling from CB2, they are going to control these factors across the macrophages, the neutrophils, the T cells, and dendritic cells in a cascade of different ways. Next. This gives you an idea of how CB2 activation works. It talks about the other molecules that are endocannabinoids, the palmitoylethanolamide, the OEA, and the PEA, and how they activate PPAR alpha receptors. Beta-Caryophyllene also activates PPAR gamma receptors, and it blocks nitrophic factor kappa beta, which is a major influence on the cytokines, the negative cytokines that occur. So it's blocking different ways of inflammation on the heart, the brain, the gut, and the throat and the airways, all in one. In addition, it's actually interfering with vascular inflammation in particular. Next. So it's interestingly enough, I point out that it's shifting the immune cells from the M1 type, the activated microglia of the brain, from brain inflammation, down to the healing type. And so it's resolving inflammation. It's changing the cytokine factors and the inflammatory markers, and it's improving the resolution of the brain in terms of its function and resolving the inflammatory signals that go on. It's blocking so many of the receptors that are involved, and it's actually influencing the blood-brain barrier and turning off the leakage in the blood-brain barrier that is so common with inflammatory neural conditions. Next. One of the areas I want to get into is mast cell activation syndrome. Now, this is a peculiar syndrome. It's becoming more populated with the COVID, long COVID, but it does represent about 15% of the population has this condition. Now, it's represented by hives, rashes, itching, irritable bowel symptoms, dry skin, reactions to anesthetics, a whole bunch of sensitivities. And it has to do with rashes and itching, and inflammation, but there's gut problems and pain, all sorts of things. And it's a cause for anaphylactic reactions. So it's a terrible, difficult problem, but beta-Caryophyllene could rectify this situation directly. Next slide. So beta-Caryophyllene has been active against mast cells. It's shown to actually block anaphylactic-like shock in animals for mast cell degranulation and histamine release. But the mast cell has a huge number of receptors, and these receptors create an inflammatory situation and regulate so many other situations and even pain. But by turning this off, and beta-Caryophyllene actually turns this off through a number of different mechanisms. In particular, and that has not been yet identified, is where it's turning off the histamine receptor exactly. But it's documented that it is doing that in a very clear fashion. Next slide. So as a result, I've used this product in a number of people, and I'm getting some incredible responses. With BCP had a much more had a minor attack today, minus the panic, and my digestive pain has disappeared. It works. It's highly effective. And in at the Hartford Pain Center Treatment Center, where they are treating large numbers of people with Ehlers-Danlos syndrome, which has to do with a hyperflexibility. And these are the people that have about 50% of these people do develop a mast cell activation disease. And so these people are using it consistently and getting great results with it. Next slide. So let's get into the neurology. Now, I said before that beta-Caryophyllene activates CB2, and we talked about the inflammation regulation. It's keying in on the glial cells, which are your immune cells in the brain. And it's controlling inflammation, immune responses, but it's also working at the neuron. It's controlling the ion channels, the ligand receptors, the synaptic functions, and these are often ignored in much of the literature and much of the publications that you might see online. And these all affect the neuropsychiatric and the neurologic conditions that are the basis for much of our neurologic disease. So when beta-Caryophyllene is targeting mainly the CB2 receptor, but the activation cascades into a number of different elements. It's working over here on the mast cells, and it's controlling anti-allergy and pain, and it's also working over here and working on the amyloid and the neurodegeneration and the gliosis that occurs with Alzheimer's disease. And plus, down the center, it's working at neuropathic pain. It is superb for neuropathic pain, and it's actually activating the brain-derived neurotrophic factor for improved mood and memory deficits. So all of these things are orchestrated by beta-Caryophyllene. In epilepsy, it's highly effective for epilepsy. And in fact, I found that I found that my early use of it was in terms of relieving epilepsy. Patients in Mexico were taking beta-Caryophyllene topically and relieving their seizures acutely. It has all of these benefits that are listed here, and it has incredible control. Now, it doesn't work. It doesn't really work alone. It works really well with cannabidiol. And I recommend it highly for combination, but it will reduce the amount of Caryophyllene that's required, and it will improve and reduce the amount of cannabidiol that is used, and it will improve the total function of the individual and relieve pain as well. Now, what about neurodegeneration? BCP effects on the brain are phenomenal. They regulate the endocannabinoid system in particular. They promote neurogenesis, so the development of new cells and new linkages to those cells. It's shifting the microglia to the M2 healing type. And so it's resolving inflammation. It's restoring the blood-brain barrier. It's regulating the autophagy, or the breakdown and taking out the garbage of the cell from misfolded proteins. It's preventing tau tangles and neurodegeneration, and it's increasing mitochondrial formation and function without increasing reactive oxygen species and inflammation. So in Parkinson's, it has amazing potential for the use of it. But unfortunately, I have not seen it as a cure for Parkinson's. It is effective. It reduces the symptoms. It reduces the pain, but it doesn't necessarily resolve the problem. It could prevent progression of Parkinson's in particular. Now, this is an interesting study that was done in ischemia, and they used combination of cannabidiol and Caryophyllene alone and in combination, and they found that the combination was highly effective for the improving the absolute results, but both worked very effectively in reducing the trauma from the ischemic event. But the combination actually worked the best. And in the retina, the eye. So many people are faced with eye diseases these days, and it's a terrible, horrible problem that we haven't found a solution for. There is no effective medication for the prevention or the treatment of this disease. And what I found that in a patient with macular degeneration, diabetic retinopathy, and an ophthalmolitis, which is an inflammation of the optic nerve and the retina. He had been going on after he had an infection with Klebsiella sepsis. He took the lipid liposomic beta-Caryophyllene for 4 months, and he resolved his entire abnormality, and he was totally released from the ophthalmology care where he had been involved with for 4 or 5 years. So it has particular benefits in this area. And I was amazed and surprised at this, but I've gone on to use it in other people as well. And I'm seeing the same sort of benefits as well for glaucoma and possibly cataracts. So I wanted to get across the role of inflammasome in activation in neovascular disease. So the inflammasome activation is a particular activator for many of these neurodegenerative conditions. And the CB2 activation is a key and important part of BCP's benefit, but it also encompasses PPAR alpha, VEGF, tumor necrosis factor alpha, the proteins on our membranes that control the leaky junctions, ICAM and VCAM, and the NLRP3 inflammasome. It's blocked by beta-Caryophyllene. And so these are neurovascular diseases in macular degeneration that could be aided by beta-Caryophyllene in specifically. So what about cardiovascular? You know, I mentioned about different things about cardiovascular help and the anti-inflammatory role. So it has been shown to be effective in animal studies for myocardial injuries, endothelial injuries, atherosclerosis, endothelial dysfunction, pericarditis, and cardiotoxicity. All of these things, beta-Caryophyllene has shown a benefit for. And in particular, the effects of beta-Caryophyllene for cardiovascular disease are phenomenal in that beta-Caryophyllene will block foam cell action. It'll block foam cell formation. It'll block the inflammation. It'll block reactive oxygen species and the signaling of the cell, and it will actually relax the blood vessels as well. Now, it does this mainly through the PPAR, the CBD, CB2 receptor, but it also activates the PPAR alpha and the PPAR gamma, leading to reduction in cholesterol as well as triglycerides. It decreased triglycerides and decreases cholesterol, but it improves insulin resistance and reduces insulin resistance in patients. So it has an amazing feat of benefits for atherosclerosis and should be relied upon in place of statins for their therapy. This is a particular study that showed that beta-Caryophyllene was as effective as statin drugs for a reduction of cholesterol. And it reduced the LDL by 39% and increased HDL by 43% after a high-fat diet. It's highly comparable to atorvastatin as well. Next slide. Anxiety and depression. So stress leads to anxiety and depression, and they're a continuum, actually. And it seems that a lot of this has to do with brain inflammation. And so beta-Caryophyllene is specific for controlling the receptors that are involved with this, serotonin receptors and the GABA receptors that are so important for modulating the amount of neurotransmitters that are being released. It attenuates neurotrophic pain and depressive behaviors in mice. And it's an antidepressant effect on restraint plus stress-induced depression. So it's really working well on stress as well as the other benefits. And it's producing major changes for anxiety, depression. So I use this as some examples, and the relief of depression is almost immediate. These testimonials harbor on that particular point. They make the point that this is immediate effects, and they're profound effects that relieve incredible amount of grief and depression in a matter of minutes, whereas it takes 4 to 6 weeks to benefit from an antidepressant drug and their side effects to those drugs. Beta-Caryophyllene could do it in minutes. Sleep. Beta-Caryophyllene is superb for sleep. That's one of the common benefits that I get from unsolicited benefits that I hear from patients who are using beta-Caryophyllene, because it regulates the serotonin receptors. And these may have to do with our anxiety levels and the stress levels. But what exactly it is, it decreases the sleep latency, the delay about going to sleep, and it increases sleep time. It actually induces a sedative activity and an anxiolytic effect for many people as well, and improves the sleep duration and quality. Next slide. So I've used it in pets in particular, and the pets really respond well. They put these particular animals, put them right to sleep. It sedated them normally, but they also had increased activity. It was also used to help their pain levels as well. Next slide. So the metabolic effects are really quite profound with using beta-Caryophyllene. For diabetes, it actually increases the uptake of glucose into the muscle cells. It increases the secretion of insulin, and it prevents the oxidative stress and inflammation on the pancreatic beta cells, so that they can produce more insulin and maintain their production. In addition, it's reducing the absorption of glucose through the small intestines, and it's preventing any liver storage problems that lead to inflammation. It's also correcting for the gluconeogenesis, the high levels that occur, and it's correcting for much of the lipid release that occurs. Then as the increased insulin secretion controls the blood glucose levels, and the reduced glucose absorption mean you're going to have a better control of your diabetes. But this is just the diabetic control. It's also going to control for inflammation in the body as well, which is a major problem and complication from diabetes. Next slide. So I've listed off the number of benefits that go along with this. And the last one is non-alcoholic fatty liver disease, which is actually epidemic in the country right now. It's a major cause for liver transplant at this point. Beta-Caryophyllene could correct that in a heartbeat and resist and prevent these complications, along with a proper diet. Next slide. So when we're talking about metabolism, we're talking about the obesity that can occur. And what beta-Caryophyllene does is it has effects on the food intake. So it decreases the desire for food. It upregulates the GLP-1. We've got a number of medications that are touting the major benefits from GLP-1 agents right now in terms of atherosclerosis, as well as the control of glucose. But it also regulates the uncoupling, mitochondrial uncoupling, which induces energy expenditure. So the uncoupling means that the mitochondria will burn more energy and burn it more for heat. So that means we're talking about brown fat versus white fat. It's increasing mitochondrial production and actually increases the number of mitochondria and their function, but it decreases the reactive oxygen species as well. So one of the problems with the increasing mitochondria is that they produce a lot more reactive oxygen species, but beta-Caryophyllene prevents that ill effect and tones that down completely. Next slide. So in this particular study, they looked at the intestinal barrier dysfunction caused by obesity, and beta-caryophyllene was corrective in all of these things. And so it holds a major role in correcting for abdominal pain and inflammatory bowel disease and irritable bowel disease. Next slide. So I've got a couple stories to tell you that from testimonials where people have lost significant amounts of weight within a short period of time from using beta-caryophyllene without any side effects. Now, this wasn't solicited. These were not people who were using the substance for weight loss. They just noticed that this particular benefit occurred for them. And there was no side effects from it, and they were able to maintain their weight loss considerably without any major dietary change, except for they just weren't eating as much. Next slide. Addiction. So the CB2 receptor is an agonist for substance abuse. That's true. But this beta-caryophyllene takes it to the next level. It takes it to, contributes, it blocks the reward and the addictive components of addiction in the brain, in the hypothalamus. It blocks cocaine, opioids, nicotine, methamphetamine, alcohol, benzodiazepines, and THC even. Now, one of the particular things I just pointed out was that it blocks food addiction as well. So you get all these benefits. Everything that is really related to reward and addiction is inhibited in this particular process. Next slide. BCP stimulates the release of beta endorphin at opioid receptors. So it's actually activating our opioid receptors for additional pain relief, but there's no tolerance that occurs. And so you can take it as continually and not worry about developing a tolerance, but you're actually activating opioid receptors. It inhibits methamphetamine taking and seeking behaviors. It inhibits cocaine addiction by activating the PPAR alpha and PPAR gamma receptors. I mentioned those before. And it inhibits nicotine taking and nicotine seeking in rodents. Next slide. So this particular story was of an animal model of osteoarthritis, and they verified that there was no tolerance effect, that there was the animals got the relief, but they continued to have the relief, and there was no tolerance effect from the beta-caryophyllene. And so that's really encouraging to say that there's not going to be require additional dosage in order to maintain the protection and the pain relief from beta-caryophyllene. What about viral and COVID? Well, I think we're inundated with COVID, and so I'm just going to touch upon it briefly to say that that beta-caryophyllene has been studied in COVID, and it has blocked the intestinal inflammation, myocardial inflammation, pulmonary inflammation, and renal and brain inflammation. All these things. It has controlled the cytokine storm, and it's actually modulated the immune system to reduce inflammation in the brain by turning it to the healing phase, the M2 phase. Now, it actually inhibits the ACE2 blocking, so that would inhibit the acquiring of the virus into the body. Next slide. And cancer. Cancer is the key. I feel very aligned with this because of the incredible benefits of caryophyllene in terms of cancer prevention. It protects against proliferation, against the formation of grouping of cells in cancer. It protects against the angiogenesis and metastasis. It protects against the inflammation. It protects against the pain. It does all these things by multiple mechanisms, but it's incredible the amount of benefits that it can provide. Next slide. One of the key factors that I think is very, very important is its protection of the DNA. Not only does it protect the DNA from damage from chemotherapy agents, but it also protects them from natural abnormalities that occur in DNA that lead to cancer. And then it actually protects for the repair of the mutagenic DNA damage that may occur from different substances, from toxins that we are exposed. So it's doing all of this. It's protecting our DNA so well that this could be a major factor in its prevention and from cancer primarily, but also in the form of chemotherapy, which often modifies the cancer cells in that way. Next slide. So it protects the DNA and epigenetic changes for normal cells. So in normal cells, it's protecting against DNA changes, but it disrupts DNA and mitochondria in cancer cells. It's actually disrupting the cancer. It's disrupting the DNA. In chemotherapy, it concentrates chemotherapy and in the body, in the cell. So it's sensitizing and the toxicity is enhanced, but there is synergy. There's synergy with beta-caryophyllene and the chemotherapy for destroying cancer. It modulates cancer receptors, enzymes, transport molecules, and particularly CB2 and PPAR receptors. It inhibits angiogenesis, migration, metastasis, pro-inflammatory mediators, nuclear. It does everything. It's incredible the synergy that this offers. Next slide. Furthermore, I've got 10. It controls cancer cell cycles. So the replications from one cell to another cell, it stops them mid-cycle. It blocks the inflammatory and the signaling that goes on, and actually it stimulates inflammation in the cell to the point where it causes cell death. It causes a regulation of the gut permeability and metabolism, microbiome. It improves that, it decreases the permeability, so there's less leakage and there's less effects from our microbiome in a negative way. It modulates our oxidative stress, reactive oxygen species, redox, autophagy, and glutathione levels. And it does it in a beautiful way where it combines very effectively for enhancing the killing effects. Well, I want to get to the summary here. And then the summary, I'm talking about natural herbal food substances. Beta-caryophyllene is a natural food substance, and you can take as much as you need to get to the benefit level that you want and you want to do for your performance. It is a broad spectrum cannabinoid. I mean, we don't really talk about it much as a cannabinoid, but it is truly a broad spectrum cannabinoid. It has FDA acceptance. It's low dosing. It's few adverse side effects. It's synergistic with cannabis and more. It's synergistic with many compounds as well as cannabis. And it's a cannabis alternative or enhancer. You can go either way. You can use it as an alternative if you are being faced with drug testing, or you can use it as an enhancer. If you're not getting the relief from the cannabis that you're using, you can combine them and get additional relief. And it's an established, effective liposomal format, means it's bioavailable immediately for the delivery to the body and to your sensations. Next slide. So I've put together a number of products. I've got 4 products that are listed. I've got BCP topical, I've got BCP liposomal, and I've got BCP as a topical gel, which has terrific properties for analgesia. And then I've got the crunches, crunches are like 1 centimeter cookies. They can give you a real nice effect. They can relieve pain. They can relieve actually your blood glucose levels as occurred in some patients. So it's a snack. It's good for pets. It's good for children. It only has 9 milligrams of beta-caryophyllene in it. So you can take 1 or 2 depending on your level. Now, when you're dosing with beta-caryophyllene, you have to find the right dose for you. It's a lot like cannabis in that regard because people have different sensitivities depending on their depletion of the endocannabinoids receptors or different systems that they have. They could respond to a small dose or they might require a larger dose. And I just tell people, guide people that because it's a natural food substance, that they can take as much as they need, and they increase the amount to to maximize their performance level. If you're dealing with pain, just find out what the dosage is that works for you for pain. If you're dealing with inflammation, find out what the dosage works for you. And then you can use that repeatedly, or you can back down. There is no tolerance effect from it. Actually, I see kind of a reverse tolerance. Over time, people don't need as much. But there's incredible mood effect and energy that comes from this. And I've had some surprising stories from patients who have been using it. Next slide. So I can answer questions, and I'll be happy to discuss the benefits of this. The whole object here is to create balance and complement health through the action on the endocannabinoid system. And I hope this lecture has been available and it has registered with you in the benefits that I've tried to offer here.
Excellent. Dr. Blair, this has been absolutely amazing. We do have some questions that I'm going to ask you from our viewers. And then we'll just talk a little bit too about how we work with patients using your products, because we do. A lot of our patients, this is the first place that we go to, is because a lot of them are scared, right? They're scared, they're nervous about using cannabis as medicine. And so as nurses, we love to educate and teach that you can modulate the endocannabinoid system using non-cannabis formulations to get, can you hear me? Oh. Okay. And so we've been using it a lot for children, for patients with cancer, for autism, for epilepsy, for skin conditions like eyesight. For myself personally, it's decreased my THC tremendously. I am a patient that has autoimmune condition that is very, very debilitating, and a history of complex PTSD, and a combination of CBD and using β-Caryophyllene and other modulators that you taught me about, Dr. Blair. You've taught me about a lot of other things that can modulate the endocannabinoid system. And what we're doing as well as nurses is we're teaching on the endocannabinoid dome. And so VCP has been this presentation educates on how it can work on this entire dome, which includes the endocannabinoid system, the microbiome, and the lipidome.
Yeah.
Really powerful.
And really how it ties it together. I spent 36 years in conventional care, and I still wonder when they're going to wake up to this, right? Cardiovascular, diabetes, metabolic, obesity, neurovascular, just everything. If people were to take this on a daily basis, what would be the eradication of pharmaceuticals?
Right. Yeah.
We wouldn't need them anymore.
Yep.
We wouldn't. At least we should really make it our primary go-to therapy, as cannabinoids should be the first line of therapy rather than the last line of therapy. And if we could get that populace, we get people to understand the benefits of it and get reliable products out there that do work, then I think we could have some success against the pharmaceutical companies.
Absolutely. So we do have a question. There was a question on cancer and about dosing. And I know, I'll let you answer, and then I can answer how we've taken care of patients with dosing because we've utilized your guidelines. But for folks in the fight against cancer, how many milligrams of your BCP tincture per dose, and how many doses per day? Is a question.
The typical dose is going to be 30 milligrams, which is 1 milliliter of the liposomes. 1 milliliter of the liposomes twice a day, 30 milligrams twice a day, so 60 milligrams a day. That generally is effective, and I find it permeates the body very, very nicely. Now, there's some patients who actually can do with less, and maybe for somebody who has resolved their cancer, they could use a lesser dose. So there'd be, in matter of prevention, maybe half a milliliter twice a day, or 1 milliliter once a day. And then there's some people who get particular sensitivities, and they find that using a little bit more, using a double dose of 1 milliliter 4 times a day has been highly effective for them. In fact, we've got a shared case where we reversed a malignant brain tumor in a gentleman by him using 4 milliliters a day for him. But that's not generally my recommendation. I owe it to individuals to decide what maximizes their performance and what is effective for their therapy.
So here's a good question too for dosing in particular, because this is when I'm working with cannabis formulations and we teach about microdosing, dosing multiple times a day, small amounts, right? Very similar to, you want to have glycemic index. You want to have a stable amount of glucose in your system to nourish your cells. So would you recommend that? So the endocannabinoid system is going on and off all day, modulating all of our biological processes. Would it make sense to possibly dose regularly, like breakfast,
4
lunch,
times a
dinner,
day.
bedtime? A little bit. That's how I do it.
That's a very reasonable approach. And since it has such great anti-inflammatory properties, then you're going to get that kicked into the system, and you're going to reduce inflammation. You're going to reduce pain with it. I think that would be an excellent approach for certain individuals who had the time and had the devotion that they wanted to use it that way. That makes sense. But for most of us in our busy lives, we get, okay, twice a day, I can handle that, but I don't want to do any more than that.
Right.
Yeah, for sure.
Now,
And
the other thing I want to point out is that when I'm talking cancer therapy, I'm always talking about combining it with a full spectrum cannabis.
Yes.
Yeah, and sometimes other pharmaceuticals and chemotherapies and things like that, because it is synergistic, right?
Yeah.
But
Right.
the onset and duration, like if we were to mimic the endocannabinoid system, always having some receptor activation, right? That to Sherry's point, and having something always available. How long is it active after I dose? How long does it stay in the body?
Their studies show that it stays in the body for 12 hours. To 24 hours. But I think the duration of effects have been more like 8 to 12 hours. So that's when I get the significant amount of relief from symptomatology that goes on. Now, I have had patients take it once a day, and they've gotten terrific response from just doing once a day. But it's highly variable, and I want to point to customizing it to your performance level and adjusting it to your maximum performance that you can get with it.
Yeah, I like that. It's new thought as opposed to 30 milligrams twice a day at these set times. No, read your body.
Well, it's plant medicine, right?
Yeah.
We're teaching people how to pay attention to their smart bodies that are always giving us little messages to do things
That we ignore.
we ignore. Exactly. And the other thing I would love to promote today is that and give you great thanks and a lot of gratitude for being a contributing author and the book that's going to be coming out in the fall. It's currently being edited, and we are going to be talking about cancer and
Unspoken cures.
Unspoken cures.
Ooh,
Truly. Can't say the
great.
word cure, but it's unspoken. These are things that are happening that people aren't talking about, and how cannabinoids, β-Caryophyllene has its own chapter in the book.
Absolutely.
So that's how powerful and important this is to us. I have been a nurse in the conventional system for over 25 years prior to coming into cannabis as medicine, working intensive care, working chemotherapy. I'm a chemotherapy nurse doing cancer research, and I have never in my entire life seen a product work so effectively, immediately, in synergy with multiple other products that exist.
It's very rapid.
Very, very
Wow,
rapid.
can I quote you?
Yes.
I saw a patient 2 weeks ago up in Oregon with neuropathic pain, and I'm going to try this now, 100%. I'm going to send a bottle to my sister who is obese and having diabetes and rheumatoid arthritis. It's endless as to the clinical applications for this, and how it is a game changer with respect to cost benefit analysis, right? If we're looking at from a harm reduction standpoint, introducing pharmaceuticals as opposed to BCP and some other lifestyle guidance, it's a no-brainer.
Yeah. Totally.
Absolutely. It has such great potential, and I wish we could get it into the working people environment to self-insured companies that would be could use this as an herbal benefit for taking care of pain, for patients who cannot use cannabis in particular because of drug testing or safety threats. They could use this product and get all the benefits of cannabis without having to risk their jobs.
Yeah. Do you have any other questions?
Project for next year. Well, no, I think I'm good. I'm good. There's so much that we have to do with respect to this front, but thank you for coming on and sharing your wisdom and knowledge. It's just incredible to have such a resource in you to work with and to work with us, a partner. You're our business partner. We're going to be going forward to get into those employer work groups very soon, and it's just a matter of receptivity and prayers being answered.
Yep.
I appreciate you and for all that you do and your consulting basis for patients. I've got to send patients to you. I've got to send patients to a reliable source to manage them, and I can't do it myself. So I appreciate what you do, and I would like to send more patients to you for management.
Well, sure, we'd love that.
We would love that.
It's a back and forth. Anybody that freaks me out, they go right to you. So it's how we shore each other up, right?
That's it.
So doctors and nurses always work together.
Yep. So Dr. Blair is on our website as one of our physicians that we've been working with. He is also in our Green Nurse approved marketplace, where we have been vetting products and services for the past 9 years each. Elizabeth and I have been nurses forever, and we're truly here to decrease stigma, and we're truly here to help you and educate you and empower you to make choices that are best for you. There's no one more important than you, and you all deserve to feel good.
Yeah, so build your summer care kit. Get the crunches, the topical, and the BCP itself. It's just, it'll change your life.
Yep, and I'll put this right up here one more time. There you go, Dr. Blair. Thank you so much. And remember, everyone, what it's all about. It is truly about living your best life and helping others do the same. And here's one of my favorite videos to wrap it up. And Marta, who you're going to see on here, is now taking BCP.
We're here to educate and empower patients to make choices that are best for them. We're also here to decrease stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I was cannabis agnostic for many, many years. And the more research I did, the more I discovered that cannabis is this amazing medicine.
I was told that I had a 4-stage pancreatic cancer. The doctor really told me he couldn't do anything else. He gave me her name, and she called me and she came to my house. She started to give me cannabis. My oncologist was puzzled because he couldn't find the cancer anymore.
All of the learning that we get comes from the Green Nurses group, comes from their support, comes from their guidance. I trust everything that she says.
Simply meet people where they're at. The plant doesn't, stress to grow, so we don't stress to share it. We're healing people.
Cannabis has been used as a medicine for tens upon thousands of years. Here's the big message. Cannabis needs to be federally legal. We need to have laws that are the same across all 50 states that allow access to anyone and everyone who wants to utilize this powerful medicine.